Good afternoon, dear patients. Today we are going to talk with you. While the comprehensive medical examination was being conducted with great care and precision, the specialists carefully observed every single detail to ensure that nothing was overlooked during the entire assessment process. In our clinical assessment, we carefully considered the distinct possibility of the initial focus being a localized manifestation of psoriasis, the presence of flat-topped condyloma latum, and we also took into account the potential for, and possibly, Lichen Planus. These were the most likely diagnoses. This brings up the point that many patients believe that when they come to a dermatologist, the doctor should be able to determine everything just by looking. It was quite difficult to determine the preliminary lesions just by looking. In any case, samples were taken from the surface of this lesion and from inside the canal. Tests for sexually transmitted infections were performed, including for the human papillomavirus. However, all these tests came back negative. Naturally, a smear for flora was also taken and everything was normal there. Everything was calm on the part of the urethra. We didn't diagnose prostatitis. Prostatitis can be found in anyone. That's why in such cases, when you don't know what it is, it's very easy to just diagnose prostatitis when there's redness of the glands and other issues, and then treat it. Naturally, that wouldn't have helped. It would have only caused the patient to become angry. So what was done? At first, before any surgical intervention, having assumed these diagnoses, we tried external therapy, as well as sodium tescalfate intravenously and calcium gluconate. External therapy, in addition to the injections I mentioned to you, and antihistamine medications. Orally, it consisted of B, the use of a strong glucocorticosteroid. The use of an ointment like Dermovate consisted in the fact that we used an antipsoriatic drug, the external agent Naftaderm, and accordingly we also used calcipotriol preparations. We did all this over the course of several months. There was absolutely no noticeable effect whatsoever. There was truly and absolutely no effect at all. What exactly is the best course of action that should be taken in a frustrating situation such as this one if there is absolutely no effect? And as a hormonal ointment, we might as well have used water. What was done next? By the way, the lesion had existed for about a year. Next, we tried to administer a direct injection of Diprospan, subcutaneously and intradermally. A regular syringe, specifically an insulin syringe, was used and the drug was injected in a small dose. Since the treatment area was relatively limited in size, the dose was also kept at a fairly low level. We waited for about 2 full weeks, but the overall appearance remained almost entirely the same as before. When we started to resemble those wise men who lick the chest but never open it, we decided to remove the lesion directly and send it for histological examination. There were no other comparable or related lesions found anywhere else, either on the rest of the body or on the surface of the penis. The patient was thoroughly examined. What was discovered? Histologically, it was identified as a Verruciform Xanthoma. This is a comparatively uncommon medical condition that primarily manifests within the tissues of the oral cavity, with the genital organs being the next most frequent area where these lesions tend to localize. Under certain clinical circumstances and specific conditions, this condition manifests itself as a distinct yellowish or perhaps even a reddish lesion located on the sensitive skin of the genital area, which is exactly what we are observing in the specific medical case we are reviewing today. No one knows why it appears. While several prominent authors and researchers in the field have previously reported finding traces of human papillomavirus type 6 in similar cases, we conducted our own extensive testing for this specific viral strain and found that no such virus was detected in any of our samples. Consequently, it is now widely believed by many experts that the underlying cause of this particular disease is not viral in nature, but rather stems from the progressive degeneration of epidermal cells and the structural keratinocytes within the skin layers. The lipids within these structures are eventually captured by specialized immune cells, directly leading to the formation of the visible papule on the skin surface. If you happen to notice such cases appearing, you might wonder about the best course of action to take. In these specific instances, professional medical removal is still highly recommended to prevent any further complications. Squamous cell carcinoma can develop within such lesions. This has been described in the literature, so removal with histology is considered a mild precancerous condition. Of course, there is no direct link to cancer, but such connections are rare, though they have been reported. That is why removal is indicated, as was done in our case. This is what I would like to say. Many skin diseases can begin with the genital organs, and we observe this in our clinic. And the lack of knowledge about these skin diseases, as we see in our dermatovenerologic dispensary, one patient told me, since I am a venereologist, he said, "Doctor, why did you come to me with a red genital organ?" So what happens is, first of all, as I said, this disease could have progressed to cancer and then it would have been too late. Secondly, the patient should be monitored by a doctor. And if this standard therapy, if you haven't done that, then you need to move on to more aggressive methods, such as removal, histology, and so on. I do what I can, of course. I try to postpone removal options because the penis is not such a large organ that you can keep removing parts of it all the time. But if there are no other options left, then that's the last resort. Whenever it occurs, basically, this is necessary both for diagnostic purposes and for treatment at the same time, especially when there are single lesions, as in our case.